Guys, welcome to the another topic of discussion today, that is pre-operative management of the medication. And guys, if you are new to my channel, please subscribe my channel so that it will motivate me for doing more videos for you guys. Okay, let's discuss today which drugs to continue, which drugs to discontinue before surgery with the help of mnemonic ABCDE, MNO, P and ST. So first, on A, you will be seeing that antihypertensive medications. So patient who is taking antihypertensive medications, all should be continued on the day of surgery, except which other things have to be discontinued on the day of surgery is ACE inhibitors and ARBs. ACE and ARB inhibitors should be discontinued on the day of surgery. And next thing is actually patient on antipsychotic medication should be continued on the day of surgery. Okay, it may be either anti-anxiety medications or anti-depressions medications. Everything had to be continued on the day of surgery, and we should take adequate precaution regarding this drug interactions, everything. Next thing is actually patient who is non-asthmatic, who is on medications or corticosteroids, something medications or a beta blocker had to be continued on the day of surgery. Okay, next, your anticonvulsants and anti-reflux medication like H2 blockers or your proton inhibitors, all to be continued on the day of surgery. And apart from that, aspirin is the one. Low dose aspirin can be continued in the day of surgery, but in these conditions it must to continue on patient having a prior PCI, percutaneous coronary intervention, or high grade ischemic heart disease is there, or patient who is having significant cardiovascular dysfunctions is there. In these conditions can have to be continued. If there is no other high grade events or not, the high risk factor is not there, then it can be discontinued 3 days before surgery. So these are the things: antihypertensive medication, antipsychotic, asthma medication, anticonvulsant, anti-reflux and aspirin have to be continued on the day of surgery. Next thing, B, is your beta blockers. So beta blockers, yes, beta blockers have to be continued on the day of surgery. For example, in patient with MS, mitral stenosis, for rate control, we will be giving beta blockers in hypertensive patients. So all this in cardiac failure, whichever condition, beta blockers should be continued on the day of surgery of the patients. Next, for C, is mostly your corticosteroids. Patient who is taking oral or inhaled corticosteroids, which had to be continued on the day of surgery, either oral or inhaled corticosteroids. Next thing is actually your COX-2 enzyme inhibitor. On next C is COX-2 enzyme inhibitors. Regarding COX-2 enzyme inhibitors, if the surgeon is concerned with bone healing, then you have to discontinue on the day of surgery, or else COX-2 inhibitors can be continued on the day of surgery. Next, your coumarin derivatives. Coumarin derivative is warfarin. So if the patient is on warfarin, it should be stopped 5 days before surgery. So 5 days before you have to stop in this patient. So regarding C, corticosteroid have to be continued, COX-2 enzymes have to be continued. If the patient is if the surgeon is concerned with the bone healing, then it should have to discontinue. Coumarin, warfarin, you have to stop 5 days before. Next, concern with the D. D is nothing but your digoxin. So digoxin have to be continued. Patient heart failure have to be continued during the day of surgery. Next other thing is your diuretics. So diuretics is mostly, it should be discontinued on the day of surgery, except if it is it's used for the thiazide diuretics, have to be continued. Mostly in hypertensive patient, thiazide diuretics will be there. So in that condition, if for hypertension, if thiazide diuretic is started, then it have to be continued. Okay, next your diabetic medications. So coming to the diabetic medications, there are two. So patient may be either on oral anti-diabetic drugs, or the patient may be on insulin. So if the patient is on oral anti-diabetic drugs, except SGLT, this is sodium glucose transporter 2, that is dapagliflozin, should be discontinued 24 hours prior to surgery. Remaining all other oral anti-diabetic drugs have to be discontinued on the day of surgery. Only for this have specific 24 hours before. Remaining on the day of surgery, you can discontinue, is also fine for that. If the patient is on insulin, short-acting insulin should be discontinued on the day of surgery. It should not. It should be discontinued on the day of surgery. If the patient is having type 1 or type 2 diabetes mellitus, so type 1 diabetes patient will be having some insulin preparation regarding that. So long acting preparation, if the patient is on type 1 diabetes, then you have to provide 1/3 of the dose of the long acting preparation on the morning on the day of surgery. If the patient type 2 diabetes on insulin, if he's on long acting insulin, you can give half of the dose of long acting preparation on the day of surgery. Suppose you have another scenario, if the patient is on continuous infusion pump, what will we do? If the patient has a continuous insulin pump infusion, then you have basal insulin rate had to be continued, and strict monitoring RBS hardly should be continued throughout the preoperative period, and immediate intraoperative period have to be continued. Okay, so these are regarding diabetic medications. So next your E is eye drops. So eye drops, if the patient is on, it had to be continued on the day of surgery. Next your M for your MAO inhibitors. Regarding MAO inhibitors, it can be continued, but your drug interaction, you have to plan anesthesia accordingly, that is to avoid pethidine. It will cause chase reaction like that. In that condition, you have to avoid pethidine. So specific drugs which interact with this drug have to be avoided, or else MAO inhibitors can be continued. And next is your NSAIDs. NSAIDs, it interfere with the wound healing and something coagulating factors. So 48 hours before surgery, you have to stop. Okay. Are there if patient is on oral contraceptive pills, okay, or opioid medication, from if anything patient is on oral opioid medication or something, it can be continued. Opioid medication can be continued on the day of surgery. Next, another thing is your P2Y12 receptor inhibitors. What will they do? The patient is on. If the patient is on these drugs and you want platelet function to return to this normal element, then you have to discontinue these drugs. Mostly were clopidogrel, ticagrelol. These both you have to discontinue within 5 to 7 days before. 5 to 7 days before discontinue. Whereas if the patient is on prasugrel or ticlodipine, prasugrel 7 to 10 days before you have to discontinue. Ticlodipine 10 days before you have to discontinue, to keep the platelet coming to active function. And why considering this, there is another one indication is there. If the patient is on bare metal stent, what will you do? Or if the patient is on drug-eluting stent, what will you do? Okay, so if the patient is on bare metal stent, what will you do is, you had until 1 month dual antiplatelet therapy have to be gone. Okay, 1 month dual have to gone. If the patient is planned before that, then you have to discuss with the surgeon regarding the risk and what are the complications expected during the intra and post-op period. Then depending upon the complication, you have to plan accordingly. If he's on drug-eluting stent, at least 6 months you have to continue with dual antiplatelet therapy. You should not stop, you should not discontinue, you have to continue with that. If you want to stop, you have to explain the risk and what are the complications expected during intraoperative to the patient, and then written high risk consent have to be taken and discuss with the surgeon is most important in this manner. Next, coming to the ST is yes regarding to your statins, and another S is sildenafil. If the patient is on sildenafil, what will you do? Statins, if the patient is on, what will you do? Statin have to be continued on the day of surgery, whereas sildenafil you have to stop 24 hours before. Okay. Next, another thing is thyroxine. If the patient is on thyroxine, yes, thyroxine medication have to be continued on the day of surgery. Another topical creams or ointment, topical cream and ointment should be discontinued. Okay, should be discontinued on the day of surgery. This is per se the whole part of it. So preoperative management of medications, antihypertensive medications, antipsychotic, anti-anxiety, depression, asthma, all these medication have to be continued on the day of surgery. Beta blockers have to be continued on the day of surgery. In antihypertensive, except ACV, ARB inhibitors should be withhold. Okay. Corticosteroids, COX-2 inhibitors, coumarin derivatives, COX-2 inhibitors, when interfere with the bone healing, you have to stop it, or else it can be continued. Coumarin derivative warfarin, 5 days before you have to stop it. Okay, regarding the digoxin have to be continued. Diuretics, thiazide diuretics, if it is used for hypertension, then it have to be continued, or else you have to stop the diuretics. Okay, diabetic, depending upon the oral or insulin, oral SGLT2 inhibitors, you have to stop 24 hours prior. Remaining on the day of surgery, you can stop it. Okay, next for short-acting drugs, short-acting insulin, you have to stop on the day of surgery. If the patient type 1 or type 2, depending on long-acting preparation, if the patient is on half the dose of long-acting on type 1, 1/3 of the dose, and half the dose in type 2 can be given on the day of surgery. If the patient a basal insulin rate infusion can be continued during continuous infusion. MAO inhibitors can be continued. NSAIDs you have to withhold, and oral contraceptive OPS can be continued, and platelet inhibitors you have to stop it. This is the duration. And next, statins, thyroxine can be continued. Sildenafil 24 hours prior before, and topical creams and ointment should be discontinued. Hey guys, mostly I covered all the drugs. If I forget to mention any of these drugs, you can comment me, and so that I will update it in the forthcoming videos. And if I made any wrong issues also, you can tell me so that I will correct it in the forthcoming videos. So thank you so much guys. Let's see with another video.